Okay, we will just wait for 5 minutes. We are live now. Let the participants join so we can start the introduction of our pre-workshop webinar by Dr. Shalini Ananth.
Hi, Dr. Richa. Good
Let's just wait
morning.
for 5 minutes before we start, Dr. Shalini, because I want the
Sure.
participants to join and not
Okay.
to miss a single minute, a single second of such an insightful session today. Yes, 6 participants have already joined. Great. I'll just wait for 5 minutes, physios. Then we'll start the session. We'll start the webinar.
अच्छा है संडे के दिन भी मतलब लोग आ रहे हैं सीखने के लिए
Yes,
काफी
people want to learn.
एंथुसियास्टिक यस
They are keen to learn, especially in this area. This is such a underrated field, I would say.
ट्रू
So now people are getting more and more interest, and they want to know new skills. So yes, and having a guide like Dr. Shalini is an honor. Great. Hello, everyone. We'll just wait for a few more minutes and let the participants join in. Then we'll quickly start with Dr. Shalini's introduction. I don't want anyone to miss her introduction. Okay, one more minute. At 12:05, we will start. Participants are joining in. We've got 13 participants as of now. Okay, great. So hello and good afternoon, wonderful physios. I'm Dr. Richa from Fitwell Physiotherapy, Kharadi, Pune. And it gives me immense pleasure today to welcome all of you to this amazing obstetric physiotherapy pre-workshop webinar. I'm truly delighted to see such enthusiastic physiotherapists gathered here today. And looking at the response yesterday at our WhatsApp group, whatever polls I have started, I was really amazed, satisfied, happy, and whatnot, and excited to start this webinar because I could see how keen you all were to learn about something in obstetric physiotherapy. So. Obstetric physiotherapy is not just a specialty, it is a responsibility, if I'm not wrong. So,
ट्रू
as women's health physiotherapists, we play a vital role in supporting women through one of the most transformative phase of their lives, that is pregnancy, childbirth, postpartum period. So, our knowledge and skills can significantly impact a mother's comfort, confidence, recovery, and everything. Um, I would like to add that in today's world, where awareness about maternal health is increasing, the demand for skilled physiotherapists in this field is also, greater than ever. So this workshop is designed specifically to bridge the gap between the theoretical knowledge, whatever we have learned in our BPT, MPT, and the practical application by a skilled physiotherapist, an excellent physiotherapist, Dr. Shalini Ananth, who has a vast experience, a vast practical experience of this particular field. So over the course of this particular webinar, you will gain some insight into pregnancy-related changes, some tips and tricks to treat a mother and baby during pregnancy and after delivery. So most importantly, this entire webinar is a pre-workshop webinar of our hands-on learning, which we have organized on 11th and 12th of April in Pune. So Dr. Shalini will be conducting, she will be taking care of that hands-on workshop, and it will be, a combination of practical experience, whatever she had learned, she had experienced with the females, with the women, she'll be sharing. She's really open and keen and excited to share her knowledge with you all. So let us remember that every skill we learn today has a potential to improve a mother's journey and positively influence two lives at once. So, once again, welcome to this webinar. Let's begin this journey of learning together. I would now like to quickly introduce Dr. Shalini Ananth. So, Dr. Shalini Ananth is a passionate women health physiotherapist with a rich 20 plus years of experience. That's huge. She's also a diploma holder in yoga, certified childbirth educator, pelvic floor rehab therapist, water birth educator, and Mulligan practitioner. She is co-founder of Arogya Pregnancy in Mumbai and currently the in charge of Fortis Physio Department. Wow. She brings her vast clinical expertise in this hands-on obstetric workshop and today's the pre-workshop webinar, I would say. So Dr. Shalini, without wasting a single minute, over to you.
Namaste and good afternoon, everybody. It is lovely to see all of you here on a Sunday afternoon to learn something new in a very niche line. My journey in this field kind of started in 2004 when I was posted as a part of the internship program at Jahangir Hospital in Pune in Women's Health for ANC care. When you are dealing with MSK and neurological cases, yes, I mean, we are dealing with a pathology wherein, there's a lot of pain and there's a lot of pathos and, you're trying to rehabilitate somebody. At an ANC workshop or an ANC session, the environment was entirely different. It was full of positivity, there was joy, there was happiness, and the transformation that the women is undergoing during this period was just amazing. So that fascinated me in this. And as we physios, we say that, पहले खुद exercise खुद पे करो, फिर लोगों को सिखाओ. So the journey started with me during my pregnancy. तो सारे ANC में जितने भी exercises हमको सिखाए थे UG में, so I had done it on myself. And then I realized how difficult it is. Because as a non-pregnant woman, when I'm doing a duck walk, it is like a cakewalk. But at a 9-month pregnancy, me trying to kind of, waddle around was difficult. Even though I knew about the alignment, the posture, and then I realized I need to learn more here. So that's where I kind of did my childbirth education at Lamas and a lot of pelvic floor workshops, ANC, PNC care, lactation training, nutritional training. All of this becomes, important in different aspects of this journey from womanhood to motherhood. And that's where I am trying to get my expertise here after training at least around 1,000 plus couples in their journey. So the challenges that you face in an Indian context is what I'm trying to bring here. Dr. Richa, we can't hear you.
Sorry, I was on mute. So that is a wonderful journey that you've discussed, and I'm sure we will get to hear a lot many stories from you because I know you personally. You are a wonderful speaker. So thank you for sharing your journey with us. So Dr. Shalini, on behalf of all the physios, I would like to first know about the most challenging case that you have handled in your entire these 20 plus years of experience, and what was the challenge and how were you able to overcome it, and how was the patient's feedback and not the patient, I'm so sorry to call them patient, what about the females, the women's feedback? Yeah.
This takes me back to 2008, Dr. Richa. I had a lovely couple walking into my studio, Varsha Sudeep. I used to remember her name, and because more than me transforming her life, she ended up transforming mine. And post her journey, I decided that this is what I need to do. Till that point of time, from 2005 to 2008, I was still a women's health rehab specialist. I was into ANC, but that was as a side business. मेन अपना रोजी रोटी, फ्रोजन शोल्डर, ओए नी, वो सब चल रहा था, लो बैक पेन, वो सब चल रहा था. But post Varsha, I was like, nee, I need to take this up as a full time. So, what is special about Varsha is she is a above knee amputee with a Jaipur foot. She joined me. She came to inquire when she was around in her 19th week of pregnancy, and they both met me with a lot of fear, anxiety, and a lot of hope because they had met a lot of gynecologists and they had just bluntly told her that आप high risk case हो, आपका C-section ही होगा. And they weren't that financially well off, and neither did they have a lot of parental support at that time. So I kind of, the first thing that struck me was her need to do what needs to be done so that she can attempt a normal delivery. And my first reply to her was, we are not delivering from our legs. You have one or lack of one is going to be immaterial. So let's do this. And she had already a good core because of, her ability. I don't like to call it as a disability because of her special ability. She already had a good core. So getting it, working on that, getting her to do a single leg squat, literally and figuratively. At the same time, the challenge that I faced is because when she used to put her Jaipur foot on, the belt usually comes at the lower part of the tummy. So with the expansion of it, she was unable to basically wear her foot. And it was difficult for her to go and get a new foot completely just for that journey period. So getting a simple leather belt, the men's belt, which is slightly more thicker, going to an orthosis shop, getting it remeasured and attaching it to the existing one. तो पूरा hands on workshop हुआ है मेरा उनके साथ. And then I am training along with her. I am seeing the transformation that is happening. But I need a gynac who would be on the same page with me, who would help to at least normal delivery करके तो देखते हैं. नहीं हो रहा है, हाँ ठीक है. C-section तो है ही. But getting somebody on the same page. I visited, I will not, I'm not exaggerating, Dr. Richa. I visited around 25 to 28 gynacs in the vicinity. And none were on board because they don't know what I am doing. They don't know what she is going to do. And even they were scared. Finally, we found a doctor at Vashi and he was like, हाँ, चलो करते हैं. So we three together worked along with her during her journey. And it was so kind of sir to invite me during her labor. So she was my first live birth and I played a role of a doula along with. And trust me, getting her to do one leg squat during her labor, I'm talking about it and I'm getting goosebumps if you guys can see. It is, so many years old journey, but the way the labor happened, you are just a part of something so divine. And as you all have learned in theory, a labor is a 24-hour event. Sometimes it goes even beyond that. She delivered in 2.5 hours. And I am not kidding. And holding her baby girl in my arms, it was something surreal. And that clinched it for me. जब ये लड़की कर सकती है एक टांग के साथ, बाकी मेरी लड़कियां क्यों नहीं कर सकती? And it was just magical. So that clinched it for me, and that's where uh, I went in full on into Arogya pregnancy. And then हाँ सारे गायनेकोलॉजिस्ट जो 25-28 गायनेकोलॉजिस्ट ऑलरेडी मैं भटक चुकी हूँ, सबसे मिल चुकी हूँ. I went back to them with her story, and then I started working with their girls free of cost. एक सेशन लेने दो, महीने में एक सेशन से शुरुआत की थी. एंड दैट्स वेयर आई लिटरली स्ट्रगल टू गेट थिंग्स हैपन. आजकल अवेयरनेस है. देयर आर अ लॉट ऑफ पीपल हु आर अवेयर ऑफ प्रीनेटल योगा, सामने से आके पूछते हैं. बट 20 years back down the line, it was a very different scenario. So yes, this is what inspired me.
Wow. What a wonderful case. Even I was getting goosebumps while you were explaining the entire,
And
case.
she came back for her second pregnancy also.
Oh, wow.
Yes,
Wow.
she has a son and a daughter.
What a confidence, I must say, Dr. Shalini. Thanks to you, really. I would like to thank all the participants who have already joined in, and some of them are again joining in. We have missed few messages. Thank you, FPP, to always inspire us, always support us. Thank you, Dr. Mithrin, Dr. Rukaya, and Dr. Reshma for your wonderful messages. Okay, so quickly we'll go through some more insightful learning from Dr. Shalini. So please tell us about the what happens to the pelvis, to the pelvic floor, and how we have to manage it.
Okay. So, as you can see in this image over here, now we know something called as a pelvic outlet and a pelvic inlet. How you position your body, changes it. Dr. Richa, can you show the slide in which we are basically having the pelvis, foot, and axis? The last one? Yes, this one. Yeah. Now, this image is something that as physios, you would have actually kind of, learnt in your UG and PG days. So, if you're able to see the positions in this, when your pelvis is not balanced, when you're having a pelvic tilt, you're basically having the hip which is rotating inward, the knee which is rotating inward, and the ankle is also rotating inward. So now in this position, if you see, you're already having a slightly a pronated foot as compared to when you're basically having the pelvis in the neutral alignment. When you are actually doing a full squat, now in that, if your feet is flat on the ground, okay, where does it impact your pelvis? Can you all basically tell me if you all are aware of? It impacts the pelvic inlet or the outlet. So let me kind of come back. So when your foot is flat on the ground, when your arch is basically relaxed out, you are basically going to be opening the pelvic inlet. And when you're going to be raising your foot, when you're going to be kind of going up on your toes, when you're going to be doing your heel raises, you're actually going to be increasing your pelvic outlet by more than 30%. So this is a small takeaway as to how we basically can, work with simple body alignment, which will change the dynamics at your pelvis. Something, another nice to know information. Dr. Richa, can you go to the image where we are? Yes, this one. Yeah. So now if you can see this image over here, a uterus which is basically kind of there normally aligned in your body, वो बेचारा कहाँ पे है? And when it is basically having a baby, how much of space it is taking up inside. Now in this image, if you can see, your baby actually reaches up and pushes the diaphragm into the rib cage. So there is a small, not so common, symptom or I would say a discomfort, which we kind of call it as a rib flare. Your floating ribs, which are your 11th and 12th rib, they get literally more flared out so that they are able to accommodate the baby. And this causes a lot of pain. And it is a pinprick kind of a sensation. Not all girls have it, but some of them, they do have a rib flare pain. And how do you deal with this? How you open up the thorax, to ease it out, to give them some temporary respite. And this is mainly, you can observe this when the female is around in her 8th month of pregnancy, wherein it is way too high up, because when the baby starts getting to engage, when it starts getting to descend down into the pelvis, it kinds of comes down. You see the fundus dropping down. But at the 8th month, it is way too difficult. तो ना उनको कोई भी करवट में आराम नहीं मिलता. So you have alternate sleeping positions also, so that they can get some respite in this. So this is something that I wanted to give or talk about, a different pathophysiology that you get to see at certain women. Coming to that slide where you all actually saw a jaw and a pelvis connection. Can we kind of go to that slide, Dr. Richa? Yes. You can actually read up on this. So, as let's kind of do a small activity. Dr. Richa, कितने लोग हैं participants हैं?
So we have 30 participants on
Lovely.
line right now.
So एक live demo, अभी बैठे बैठे मैं थोड़ी hands on वाली इंसान हूँ, तो मेरे को इतना theory में थोड़ा मेरे को भी थोड़ा बोर हो जाता है बाद में. I get very bored with even PPTs actually. So to make it a little bit more interactive, to make it more interesting, again मैं hands on हूँ, तो थोड़ा hands सब अपना हाथ दिखा देना इधर, ठीक है? Yes. Your right hand. Now I need you to basically, you can sit cross-legged, but I need your feet to be on the ground wherever you all are basically being seated. Either you all sit cross-legged, or I need your feet on the ground, and I need you to place your right hand at your crotch in between. Okay. So everybody is having their hand on their crotch. So is mine. Okay. So now I just need you to just breathe in and breathe out. नाक से सांस लो और नाक से छोड़ो. Just breathe in and breathe out. And just tell me what is happening at your fingers, which is there at your crotch. When you're breathing in, you feel your vagina is actually sinking into your fingers. And when you're breathing out, it is actually going back in. So when you're breathing in, your pelvic floor is actually relaxing. And when you're breathing out, it is actually contracting. I wouldn't say contracting, it is recoiling. Now, a simple exercise. Just clench your teeth. Just do this. What is happening at your pelvic floor? What are you actually feeling at your fingers? वो भी tight हो गया ना? Exactly. Now imagine this. Okay? A small factor, and how does it impact your labor breathing during birth? अब body tight हो रहा है, birthing कैसे होगा? So the baby will only come out when there is a relaxed pelvis. It has to open up. So you're going to tighten everything, and then you're expecting the girl to push. Bear down. That's a so outdated concept. You don't bear down anymore. You don't push the baby out. You let the baby out. So the vocabulary that you are using also makes an impact. The language you use. और हम पूरे बॉडी लैंग्वेज में आते हैं, पूरे बॉडी अलाइनमेंट में आते हैं. सो योर वर्ड्स, योर टच, योर कॉन्फिडेंस becomes an important role here. yesterday when we had the poll, I had, a very honest feedback which came in, the fear, that fear becomes so real actually. So, Hamara skill set, your hand has to be steady. And trust me, even when I started initially, even I used to basically feel that fear कि यार सही कर रहे हैं कि गलत कर रहे हैं, ये करना चाहिए कि नहीं करना चाहिए. So having mentors in this line makes a huge role. And I had bugged my mentors at all different times. मतलब वो टाइम पे इतना इंटरनेट और वो सब नहीं होता था. हम लोग मेल, I used to send mails to my to my mentors actually, and international faculties, and they used to come back. So that initial help, that initial hand holding was so helpful when you started this journey. So I hope you all basically kind of felt your pelvic floor contracting and relaxing just with breath work. So you all can basically kind of see, and yes, it is a developmental facial link which is actually there. So no screeching, no screaming when you're actually birthing. So labor breathing, the breath work, all of that, yes, when you all join the workshop, I will be able to share all of that, how to basically go about over here. Something, any questions that have come up, Dr. Richa?
No, not yet. I would again request all the physios, if you have any type of questions, any doubts in your mind, please feel free to share either here or in the WhatsApp group. We would like to address the questions and queries live. Please.
अरे 30 लोग हैं, 3 सवाल तो आने चाहिए minimum.
Anyway, we can continue with our learning thing.
Okay,
Anything?
so now coming to let's talk about the food. This is something I have had a lot of challenges getting the girls to eat, and also trying to get them to, a lot of myths associated with pregnancy. ये करना चाहिए, ये नहीं करना चाहिए.
This reminds me, I'm sorry to interrupt, Dr. Shalini. There are n number of myths going on.
Yes.
When you see a pregnant lady, all the family members, the relatives, they'll just throw some or the other gyan, and the
Yeah.
lady gets confused. I remember at the time of my pregnancy, my family, my relatives, everybody is, kind of thinking that they are guiding you, but they're confusing us a lot. I want you to throw some insight on some of the common myths.
Dr. Richa, let us start with your journey itself. What did you hear? What did you hear?
मैंगोज के बारे में, मैंगो से दूर रहो, पपाया से दूर रहो.
हाँ, अभी मैंगो का सीजन भी आ रहा है, और पता नहीं मैंगो के साथ कुछ एक अलग ही लगाव रहता है. अगले सीजन ही आएगा तो पता नहीं इस सीजन में वो क्रेविंग वैसे भी और ज्यादा बढ़ जाती है, क्योंकि वो आगे जाके मिलने वाला नहीं है. So I have had tremendous cravings from my girls who end up saying like, मैंगो का सीजन आ रहा है, मैंगो मना कर रहे हैं, सब खा रहे हैं, मेरे को भी खाना है. मैंने बोला मना किसने किया है? बट हाँ, the quantity is limited. So you cannot combine mango, pineapple and papaya together in your fruit bowl. But you can have either or of them in a minimal quantity. तो पूरा आपको घर में पेटी भर मैंगो आ रहा है, कौन आपको 1 डजन मैंगो खाने बोल रहा है? आधा मैंगो खाना है, उसमें भी उतना ही स्वाद और मिठास रहने वाला है. You can have half a mango. You can have 1 slice of a papaya, and you can have 1 piece of a pineapple. उसमें भी nutrients है, वो भी जरूरत है. See, they were banned at a certain point. ये Chinese whisper हो गया है. पुराने जमाने में खुद की खेती होती थी तो काफी सारी चीजें आ जाती थी, तो कोई रोक टोक नहीं होता था. तो भाई खुले मैदान में झाड़ छोड़े टाइप वाले, खाओ पियो ऐश करो वाले टाइप. तो that used to be the concept earlier, which used to put the uterus into a uterine contraction. तो अब पहले वो है नहीं, सबके पास थोड़ी लेवल ऑफ इंटेलिजेंस है, तो क्या खाना है और कितना खाना है. So anything in moderation is good. तो खाओ, मन मार के प्रेगनेंसी में नहीं लेना है. But at the same time, weight gain. Oh yes, I have got certain women who are too obsessed with their how they look and how they feel. So the question that I ask them is, do you like whom you see in front of the mirror? Most of the times it comes no, they don't like themselves because you're growing in size. Not, it's not, they don't like what they see. कपड़े fit नहीं होते हैं. That body imaging and getting them to like themselves during this journey. यहाँ से हम क्या सोच रहे हैं वो भी impact करता है. The baby feels negative at that point of time. यार मम्मी को खुद ही पसंद नहीं आ रही, मेरे को कहाँ पसंद करेगी? So the thought process inside, all of that impacts. It is a lot of counseling, lot of talk with my girls. And we break one thing at a time. Myths again, बाहर नहीं जाना, पूरा सर से लेके पाँव तक कवर करना. हाँ, हमारे टाइम पे तो मतलब अलग लेवल पे स्टोल लो, दुपट्टा लो, वैसी वाली जर्नी थी प्रेगनेंसी में. आजकल तो बेबी बम फ्लॉन्ट किया जा रहा है 20 साल बाद. तो
Yes. It's a
you're
beautiful.
you're having baby shoots, so it's so lovely to see people kind of embracing what they look now. So it's a very different diaspora, different mindsets that come into play. So वो हो गया खाने पीने को लेके. Weight gain from 8 kgs to 16 kgs, इतना weight gain हो सकता है. So it depends where you are starting your pregnancy from and what you are trying to eat to gain the weight. I have had slightly challenging cases where they were insulin dependent injections, diabetes patients, so they were already on a heavier side. So they have started, my heaviest pregnancy, I would say she started her pregnancy when she was 95 kgs. And इतना उसके खाने को न्यूट्रिशन बेस्ड किया है एंड रिस्ट्रिक्शन उसके हिसाब से ट्रांसफॉर्मेशन उसको न्यूट्रिशनल इंफॉर्मेशन दी थी कि शी हैड गेन्ड ओनली 4 kgs in her entire pregnancy, and the 4 kgs was the baby's weight, the placental weight and the amniotic fluid. I am not kidding. उसको 100 टच करने ही नहीं दिया मैंने.
Wow.
क्योंकि 100 के उस तरफ पार ना फिर डिलीवरी में उसके चैलेंजेस हो जाते हैं. एंड यस, शी टू डिलीवर्ड नॉर्मली.
Wonderful.
She too delivered normally. So they become spokesperson for you actually. आपकी पब्लिसिटी आपके क्लाइंट ही करते हैं.
Yes. Dr. Shalini, I would like to interrupt here. We are getting few questions. If you are okay, can we
Of course.
few questions? Finally, people are asking and they are opening up. So, and there is also one request from Dr. Rukaya that I'm from Nigeria and I don't understand Hindi, so kindly explain everything in English.
Oh, lovely.
Your best, Dr. Rukaya. It's just that we are habitual and that's it just happened
I
unknowingly.
didn't realize that I'm having an international student. Lovely.
Yes. So the first question we are getting is from Prajapati Priyanka 4954. She is asking that without pressure, how can we push the baby, push out the baby?
So the baby is already during labor. There are 33 hormones that are actually working. So the baby is already in an expulsion mode out of the body. Now there are a lot of biomechanics that come into play. Now this is more again a hands-on thing that when you join the workshop, I will be able to kind of, give you a live demo of this. But just to kind of give you a simple analogy so that you can have some sense of, correlation to it. Are you scared to pee? Are you scared to void? Are you scared to maturate? No, right? So, body अपने आप को संकेत जाता है ना, brain bladder reflex होता है, relax होती है, and you're able to void. Something very similar happens over here. and the baby drives the labor, not the woman. The baby is in the driver's seat. आप गाड़ी हो. So your body follows the baby. So there is a lot of CNS, ANS system that comes into play over here. So ये एक अलग, this will be a different topic in itself, which will take at least 2 hours in my workshop, where we are going to be talking about just the birth and how to birth.
So Dr. Rohini Vijay has also asked a similar question. She has asked that how to bring baby out without clenching. Can you suggest some alternate of the same thing?
So there are different breathing techniques that you do in labor. Now, when I was doing my Lama's childbirth education course, just to birth the baby, there are 6 breathing different techniques along with the positions. हमारे देश में positions तो दूर की बात है, एक ही lithostomy position पे डाल देते हैं. So there are different. Sorry. So they put in lithostomy position to basically birth the baby. So breath work over here becomes very important. Simple pursed-lipped breathing. If I can tell you. Breathe in from the nose, breathe out from the mouth. You can again keep your hand at the crotch and try doing this. Breathe in from the nose and breathe out from the mouth. Relax your jaw when you're doing this. Now, when you're trying to basically kind of gently birth your baby, just keep your hand at the crotch. Okay, just keep your hand at the crotch. Okay, relax the jaw. और मेरे को give me phonetic sounds. Just say ah. Can I have everybody doing ah? Put it more at the base. Go more base. Ah. What is happening at your pelvic floor? Now, just try to, go e. You're able to see the pelvis tightening.
Yes.
So I need a lot of ah sound when you're actually birthing. something very small for Miss Prajapati and Miss Mohini.
Yes. I think this is the best explanation we could, get.
I could go online.
Wonderful. So we'll take the other question. The next question is pregnancy ke 7th month, during the 7th month of pregnancy. Okay, any back pain, a patient suffering from back pain, shall we use TENS or not?
Ideally speaking, I do not prefer using modalities. I would prefer using ice for the back pain, and usually most of the back pain is because there is a particular ligament that is basically getting tight. So working with a simple myofascial release and stretching the ligaments and strengthening your obturators, your obliques, your multifidus, coming a little bit more in physio jargon, your deep core muscles, they will basically help to relieve and the back pain as compared to a modality. A modality is something which is temporary, because if 7th month, if your girl is experiencing back pain, 9th month it is still going to worsen it out. So 7th month, okay, fine, you might want to give TENS, it is safe to give TENS. 9th month it is definitely not. So at that point of time, how are you going to address it? So modalities are nice to use, but they are used when it is too extreme. When the girl is unable even to turn. And usually when they are unable to turn, it is less of a back pain and more of an SI joint pain. So back pain is different, and SI joint pain is different in pregnancy. We actually call it as PGPs or pelvic girdle pains. Now, as you are aware of, your pelvis is made up of 6 different joints. And the pelvis goes into a locking mechanism to protect the baby. And that's where you will end up getting all the aches and pains. because it needs to protect the baby. But if it is going to go in a locking mechanism, how will you move about? So you need to unlock the pelvis a little bit so that you can basically move.
This
And
reminds me, Dr. Shalini, you have showed us a trick during the workshop which we have done on pelvic floor. We have, I think, the SI joint pain. You have showed a wonderful technique, and we all were really amazed. I still remember.
yes, yes. So that
Yes.
will be a part of the course that I would anyways be taking up.
Yes. So there are certain things which can practically be explained in a
Yes.
better way rather than being online.
With that, I just kind of have a question. Um, does the coccyx move? Coccyx, your tailbone, does it move? And if
Wonderful
it
question.
moves, what is the range of motion of the coccyx?
Physios, can you answer this question? Does the coccyx moves?
And if it moves, what is the range of motion?
Quick,
I
quick.
don't
We
know.
need the answers. Then only we'll take the next questions. The
It is an
session
interactive session. Otherwise,
interactive.
I will get bored. Huh? I need people
Yes.
to interact.
Please answer. Right or wrong doesn't matter. Just
This is
answer.
okay.
Just
This is a learning platform. You're getting to learn over here. If I'm going to be asking you all a knee range, you all will tell me. An elbow range, you all will tell me.
Dr. Asabri has answered the 5 to 10 degrees.
Okay. Anyone
Anyone
else answering? Any other answers?
else? Dr. Rukaya said yes.
Okay, it does move. Yes, it does move.
Any other answers? Quick. We have 32 physios here online. We need some more answers. So then we can
Yeah, before
explain.
I give the answer. Yeah, I'm not going to be spoon feeding. Come on, I need some answers now.
Dr. Joed Beery answered slight movement. Dr.
Okay,
Mithrim, maybe 3 degrees.
okay, nice.
We need more answers. Come on,
Yeah,
physios.
so at least we come to a consensus that everybody agrees that the coccyx moves. Now, how much does it move? What is the range of motion of the coccyx? Any
5
more answers
degrees.
coming in?
Um,
5 degrees. Okay.
Joe answered 5 degrees.
Okay.
Okay.
Okay. I had actually attended workshop on coccydynia long time back, and in that I actually kind of learned that the range of motion of the coccyx is actually up to 23 degrees.
Oh,
Yes. And during labor, I need the coccyx to move up to 9 degrees. So, how do you move the pelvis with your positions, with the exercises wherein you're able to achieve that opening at the coccyx? So, that is something I will learn in the workshop. So, any more questions which are there, Dr. Risha?
yes, we have few more questions. So Dr. Mayuri answered 15 to 20 degrees. Dr. Rohini answered 1 to 2 degrees. Dr. Reshma answered yes, it moves maybe 5 to 10 degrees.
So,
Okay.
everybody are there at that range. Very good. Somebody mentioned 20 degrees, right? She was the closest. I wish I had a chocolate to give her.
So we had a question that how can we manage back pain during ninth month? I think that is also answered.
Yeah.
Then the next question is how to control weight gain during pregnancy.
Um, Diet. So weight gain is something that is individualistic person to person from where they are starting from and what are their eating habits. Now we have a lovely diverse country right from Jammu Kashmir to Kanyakumari. Every 200 kilometers you have a different dialect, you have a different culture and you have a different cuisine. So if I am just going to as a impassive physiotherapist, If I'm just going to give them a diet chart, yeah, protein khana hai, this fiber you need to have, this fat you need to have, this seed you need to include. If I'm just going to give them a paper, it is going to be there on the fridge magnet for 2 weeks, and then it is going to be in the dustbin. That's exactly what happens with the diet chart. Even when all of us also have been battling, weight loss or weight loss transformation journey at some point of time in our life, we have also done a very similar thing. And that's the reason mainly you end up going as a yo-yo. It needs to be customized with what they are eating. Now, the gynacs don't have a lot of time. So a very simple solution for them is, here, take the protein dabba. And this is what you need to have. But that protein box is filled with hidden sugars. So naturally, asking them, sitting with them for an hour and asking them what they normally eat right from morning till evening. You need to get that information first, that history first. And then you plan their diet chart. So more about this as to what time they need to eat, what they need to eat. Certain things you're not supposed to mix together, like you don't mix your iron and calcium tablets together. When you need to consume what. If you're having your iron supplements, then what helps its absorption better? Anybody knows what helps the iron absorption better? Can I have some answers? Anybody's
Quick
answering?
answers,
Quick.
please.
What helps iron absorption better in the body?
Quick answers, please. Vitamin C.
Yes. Very good. So this is what you need to include in your diet. So when they are having their iron tablet, it should be followed by something in a dietary aspect where vitamin C is more. Simple.
Yes.
Mm.
So there's one more question which we have missed is, if a pregnant mother has soft internal os, is there a chance of preterm delivery?
See, when there is a soft internal os, I wouldn't say, it depends on what is the cervix length. That makes an important role over here, more than a soft internal os. So if her cervix length isn't that good enough, it is a short cervix length, then most of the time I have the gynacs, they basically do as a cerclage. They basically tie it up and they open it up in the 8th month. So they are not allowed to do a lot of, pelvic opening exercises at that point of time. That doesn't mean that you can't work with them. You need to modify your exercises protocol for these kind of patients. Sometimes I have had a couple of girls who have been advised bed rest during their pregnancy because of various other reasons. One of them is, yes, when they have a cerclage done, sometimes they have a very low lying placenta that comes into play. Sometimes there are other issues that they have a very low amniotic fluid at times where they are put on bed rest. You can still exercise other muscles because during labor, your entire system comes into play. So one system is not, you can't work with one system. There are other things that can work. And that's the reason the constant dialogue with the gynac is very important. And they have their own things. Don't do this, or you don't or focus only on this. Work with this. So talking to the gynacs is also important. That way, you will also get to be on the same page with them. And at the same time, they will also learn to trust you. Yes, she knows something, or she knows what she's talking about. So they will not look at you as a threat, but look as a bridge or as a sister concern who is helping their, client. Because at the end of the day, it is their patient or, their client. And we are just there in between to bridge the gap with a little bit of scientific amount of information. Otherwise, everybody around you, once they know that you are pregnant, they love playing doctor, doctor. So you become their, friend, guide, philosopher in this journey. And yes, trust me, that responsibility, that power that you have at that point of time is too great enough. So that's where you need to exercise with caution, and your knowledge needs to come with an evidence-based practice. So this is where your skill set and your knowledge makes the difference over here.
There's one more question, Dr. Shalini. Basically, they want to know what are the red flags during pregnancy? Who cannot do the exercises in pregnancy?
Okay, so first, your vital parameters, your BP. So if you're already on a high BP thing, exercise, I wouldn't say somebody who can never exercise during pregnancy. I don't believe in that concept, because something or the other can be done. So if you are having somebody with a very high BP, you can still work with pranayams and yoga. You can still do breath work. We have had, I had basically had a case, again, special case, wherein she was advised bed rest from her 6th month onwards till her 9th month. She was on the bed, and she had joined us in her 4th month. So 2 months we did all our exercises. We got her to sit down, cross-legged sitting, working with her every aspect. In the protocol we were kind of working with her. 6 months she went on the bed, and then she was like, "Ma'am, अब क्या करना है?" मैंने बोला कुछ नहीं, बेड में exercises we can do. So just for the next 2 months, we only did pranayam and ankle toe movements, finger movements, shoulder movements, worked in sideline thoracic expansions. That's it we did for the next 2 months. Once, yes, we were talking to the doctor. I was in touch with the gynecologist. This is what I am doing with her. I'm not doing anything more than this. She's like, okay, this is safe. You can do so much. And at her 35th week, she was given permission. Now she can come a little bit in an upright position. And if she is comfortable, she can walk around in her house. And yes, for her, the sessions were again online. So that's where we had to work with her. And once she started kind of walking, the legs, trust me, the VMO was wasted in that 3 months. Okay. So once I got her upright, and once I got the permission from the gynecologist that now, yes, she can do squats. At 34 weeks with her VMO wasted, now I will get her to do squats. Can I get her to do squats? Will she be able to do squats? No, she can't. So I had to train the VMO, and I had 4 weeks. Because you normally deliver by your 38th, 39th week. In 2 weeks, I got her to do squats. We have done a TKR protocol. All of us have seen a TKR patient. And we work with that extensor lag, don't we? So how many times have you all asked your patients to do static quads? 200 times, 300 times, right? That's exactly what I did here. Nothing else. Kept a 15-degree elevation and worked in that terminal extension. And asked her to do it around 300, 400 times. I had asked her to do 500 times in a day. And that girl did it.
Wow.
Then only I could do squats, no? And then we worked with her. She had her labor at the 39th week. She started with a normal delivery. She took an epidural and then she delivered normally.
Wonderful.
So yes, there are so many small insights. It's not that we don't have the knowledge with us, but the point is integrating it with what we can do with the pregnant women. And
There's one more question linked with whatever we are discussing right now. So I would take this question
yeah,
first. Other questions I'll take later. Any specific or general exercises you would suggest from the time once the girl is admitted for the delivery, entering before the labor room, inside the labor room, that would lead to
yeah,
normal delivery?
yeah, there are a lot of exercises to be done. I don't want the girl on the bed. You want to move the baby, you need to move the mother. This is one thing that I learned when I was doing my childbirth education. You need to move the baby, move the mother. Change positions. Get her to walk, squat, duck walk, staircase. But all of this cannot happen one fine day. Yeah? You need to train the women beforehand itself. It's like you're training a person for a marathon.
Right.
And your uterus works as much as you would when you're running a 41-mile marathon. That's the amount of work your uterus does during the day of labor. So all the exercises can be done.
Great. I hope this answers your question, Dr. Reshma Bora. The other question is, can you guide on vaginal pain in pregnancy? Dr. Kate Kisani is
Yes,
asking.
yes. So vaginal pain is a part of your PGPs, pelvic girdle pain. It is basically more associated with the pubic symphysis pain, which you actually are kind of, talking from a vaginal perspective. So there is something called as a perineal massage that you can actually do. So you need to basically kind of, self finger yourself and you need to kind of, get it done. This is something that we also do, not in a childbirth or in a pregnancy aspect, but also with patients, if you're a women's health practitioner, with a vaginismus case also.
Yes.
Painful vagina, tight vagina. When a person is pregnant, वहाँ पे tight vagina नहीं हो सकता है. So you can't have a tight vagina when she's already pregnant. So vaginal pain is because of the pressure that is coming down of the baby that she can have. Easiest solution is basically kind of giving a perineal massage. For a pregnant woman, I don't want her self-fingering herself. I usually ask the partner to do it. So that helps to release more of oxytocin, which will relax the perineal muscles.
Right. There's one more question. Can a pregnant woman take spirulina as a protein supplement?
Sorry?
Can a pregnant woman take spirulina as a protein supplement? Spirulina.
Spirulina. She can, but again, the quantity. But that is something, again, I am not so much in favor of supplements. So even with a dietary aspect, if you are finding that, it is lacking because of the absorptional issues, and maybe you want to supplement it with a supplement, you can, but I wouldn't prefer going it twice in a day as a dosage. I would prefer it as an alternate day dosage. So supplements are what they seem. They are to supplement your dietary eating habits, not substitute your eating habits. So again, the word is very important over here. It is not a substitution, it is supplementation. So it is over and above that.
Yes, perfect. I hope that answers your question, doctor. The next question is, pelvic contraction exercises will help. Joyt BD is asking.
Pelvic contraction exercises during what?
It's just, the question is just this much. So pelvic
Oh, just
contraction
this much.
exercises will help.
Okay,
I think
so pelvic
maybe this
contraction,
question was asked during some of the discussion which I've missed.
okay, I think pelvic contraction, if I'm not mistaken, you're asking about the Kegel exercises wherein we train with pelvic contractions. If I'm getting the drift of the question right.
Yes, sir.
Kegels, again, you need to assess first of all the pelvic floor. First is assessment of the pelvic floor. Whether you're having a hypertonic pelvis, whether you're having a hypotonic pelvis. Based on that, your pelvic floor contraction would happen. If your client is already having, a tight pelvic floor, and you trying to train the pelvic floor with more contraction, it is not going to help. But if your client is having a weak pelvic floor, which is what you get to see normally, clinically, therein, yes, pelvic contractions or Kegel exercises will help initially. But for delivery, I don't want pelvic contraction.
So the
I
question is
need
related
pelvic
to internal
relaxation.
loss. That's what they mentioned.
So with internal loss, yes, you can give pelvic contraction. Again, when you're giving pelvic contractions, you're going to give a fast twitch or you're going to be giving a slow twitch. So you need to ratio it out and then you need to give it to them. And that again, it is around 400, 500 counts that
Right.
they need to do.
Perfect.
And
This
again, it is supposed to be only a pelvic floor contraction, and then you get to see your glute max acting, you get your TA coming into play. Then that's not what you are needing to do. It has to be an isolated pelvic floor.
great. I hope that answers your question, Joy Bidi. The next question is, does an aquatic delivery needs different exercises compared to normal hospital bed delivery?
No, it is the same set of exercises that you do, because just last year I just did my water birth education from Dr. Barbara Harper. She is Water Birth International faculty. So it was beautiful learning from her, and it kind of took me back to my Lama's childbirth educator days actually. And water birth is the most natural way how your baby can come in, because your baby is getting delivered from a water medium to a water medium. So it is floating in an amniotic fluid, it is coming out in through the water. So the exercises aren't different. Yes, the water filling capacity is different because the buoyancy acts differently in your body. So when the water is at your waist level and then the water is at your chest level, the buoyancy acts differently. So I have the women squatting in the pool. I can have the women kneeling in the pool. I can have the women lying down sideways in the pool with one leg raised up. Modified clamshell, or I think that exercise is actually called a notebook exercise. So in that modified position, yes, you can deliver. And water
Wonderful.
birth is, uh, I definitely would prefer water birth if it is available, because your work is less in that.
Great. I hope that answers your question, doctor. The next question is causes of pelvic pain after delivery and how to treat it. The other question is how to relax the pelvic floor during labor. I think on and off we have discussed these things. Still, if
Yes.
you add some other points, Dr. Shalini, please go ahead.
Uh, Pelvic pain post delivery. There is going to be a lot of aches and pains in the body during that postpartum period. That's the reason it's called the fourth phase of the pregnancy. We call it the first 40 days is pretty sacred in a lot of cultures also. From a culture wise also, you're not allowed to move about much in that first 40-day period. Certain cultures have got where they kind of bind the pelvis, trying to kind of squeeze it back and get it back in the normal alignment. There is there in our cultures also, you tie the sari, or Indonesian cultures, they end up mummifying the entire mother and trying to keep the pelvis so that it kinds of comes back. That postpartum healing is very, very important. And a lot of time, something that we have learned, but we are no longer practicing it. For all your tears that you experience during labor, they are still a superficial tear. There is no stitch which is required for it until you're having an episiotomy done. So the body heals itself naturally when you give it that resting period. So along with the nesting, there is resting that happens. But from a physiotherapy point of view, when you're having somebody coming to you with a pelvic pain, then the tolerance and the pain tolerance, your VAS scale or your NRS scale, it is for them it is more unbearable. That's the time they're going to come to you. Till that point of time, they are okay in their own house, where it is at a bearable way. So when it comes at an unbearable limit, IR or infrared lamp helps for healing.
Okay, great. So one last question we'll take now, Dr. Shalini, because we are running out of time now.
True.
Mithram is asking how to assess hypertonic and hypotonic pelvic floor. Okay, would you like to answer?
Yeah, until you're going to put your finger inside, you're not going to figure out anything.
So yes, this is again something which you can learn more into a
This
practical
is the
hands-on.
more, but this is a practical hands-on thing where you realize, first you need to understand the normal tone, and then when it is hypertone and hypotone. It is like how you assess your own muscle. See, same thing like you can actually do your biceps, right? When you're contracting and when you're keeping it. So this is the normal tone of the muscle where it's not kind of dropping down or whatever it is. So if your arm is going to be dropping down, the tone is different, where you're kind of talking about going towards a little bit of flaccidity. And hypertone was kind of going a little bit of stiffness to going towards rigidity. So this is the basic understanding as a parameter as a physio. So same thing applies even with your pelvis.
That's it. I think one question is there about the red flags with aquatic delivery with respect to baby delivering.
Aquatic delivery, red flags, there are a lot. I would have to use your UPGAR score that is normally checked. Now, this is mainly if you are a doula and you're basically kind of assisting in an aquatic delivery. Yeah? So, along with the Kynac, along with the pediatrician, the UPGAR score is different when you're having a water birthed baby. Your UPGAR score is normally checked at first 30 seconds and at 1 minute and then a 2-minute period. The UPGAR score in a water birth is first checked at a 1-minute period, not in the first 30-second period.
All right, I think we are now running out of time. We will have to end the webinar. It's already an hour now. And I hope all the physios, you have learned a lot of new things by Dr. Shalini. For more details and more detailed learning, practical learning, hands-on learning, you can go through this, our hands-on workshop slide. If you have any queries, feel free to ask us either in the group or personally. We will be happy to guide you. With that note, I would like to thank Dr. Shalini again, and thanks to all the wonderful physios who have dedicatedly given 1 hour on this Sunday afternoon. And happy Easter, everyone. So this is the Easter Sunday. So happy learning Easter, I would say. So yeah, the last lines from my side is from pregnancy to menopause, we restore strength, dignity, and confidence. With that note,
Lovely lines, lovely lines.
would
So
like
I hope you guys, I was able to kind of give you some insights, something new that you all got to learn in this hour. And hopefully I see you people registering for the workshop where I can kind of share more what I am kind of bringing to the table, and you all can kind of, make more waves and take this journey ahead as new gens.
yes, I'm sure it would be a lot of practical learning in the hands-on workshop by Dr. Shalini. So don't miss this out. And
I think by now, this point of time, I think the crowd also would have understood that this ma'am is like, all with live demos and, getting things done and less of talk.
yes, we will share the workshop details in the WhatsApp group, Dr. Prajapati Priyanka. The workshop location is in Pune. It is on 11th and 12th of April 2026. It will be a 2-day workshop. And for more details, you can contact us personally. We'll be happy to share the details. And thank you again, Dr. Shalini. Thank you again, all the physios. Thank you, FPP, for empowering us always.
True.
Um, that's all for today. Thank you.
Yes. Namaste. Bye
You
bye.
can,
Happy Sunday.
you can post if you have some more questions to ask. You can just post it in the WhatsApp group. We will try to address your questions in the group itself. Thank you, physios. Take
Yes.
care
Bye
and have a
bye. See
great
you at the
Sunday.
workshop. Yeah. Bye bye.